Hello and welcome to this week's edition of COVID Conversations. I'm Harold Fisher. Mask mandates are no longer in place for many jurisdictions around the country, and now face coverings are optional on public transportation too. This following a judge's ruling on Monday, effectively striking down the mask guidelines. But even in the face of that legal decision, the CDC continues to strongly recommend that we mask up. That's one of the many things we will discuss today with our guest, Dr. Melissa Clarke, co-founder of the Black Coalition Against COVID. Dr. Clarke, thank you so much for talking to us.
Absolutely. Thanks for having me, Harold.
Sure. Let's begin by getting your reaction to the end of mask mandates on planes and other modes of public transportation.
Well, I know there are a lot of decisions that have to be weighed in coming up with policies like this. However, from a public health standpoint, it's extremely disappointing. We're in the middle right now of what I'm calling a silent surge because people aren't really talking about it a lot. Cases have increased 25 to 40% in many jurisdictions and counties in the Northeast, the South, and the Midwest over the last 2 weeks. We know that this BA2 Omicron variant is largely responsible for that. And having that new variant introduced into the population at the same time that we're peeling back our restrictions, it's disappointing because we are going to continue to see this surge advance. The question really is, we're fairly certain that, those who are boosted will be protected against hospitalization and death, right? From the BA2 variant, but not from the spread of infection. And so for those people who are unvaccinated or unboosted, they are going to be at greater risk in public transportation now. And even those who are boosted may still, if their immune systems are low, may end up with not a great outcome from infection. And so it's a very disappointing decision at this juncture in time.
Well, you just spoke about being vaccinated and boosted, generally speaking, but your feelings about going maskless on the plane. This is a tube. The airline industry has said that air is being recirculated every 3 minutes. Okay. So your thoughts about wearing a mask, on a plane now that the mandates are gone?
Well, it's not just planes. It's also the metro transit systems, buses, trains, Amtrak, and planes as well. So yes, the air is recirculated on the plane, but there's also the line to get into the plane. There's also the TSA check line. There are all these other access points where people are together, where the ventilation might not be the greatest, where these mask mandates are being lifted. And as I said before, it makes us vulnerable because even if we know, as I mentioned before, boosting helps with decreasing hospitalizations and death overwhelmingly. But over time, your immunity, your ability to not get infected at all wanes. It decreases over time. So if it's been 4 months or 6 months since you've had your booster, your likelihood of getting COVID again is definitely high. And if you don't want long COVID, right, which we know estimates range anywhere from 5% to 60% of people who get infected with COVID go on to have long COVID, meaning the lingering of symptoms like shortness of breath and brain fog and cough and racing heart and high blood pressure, diabetes, kidney disease. These things are real. They're happening to real people every day. There are 1 million people out of work right now due to long COVID. Estimates of many more millions who are just dealing with the symptoms. So these are the considerations. It's not just about, will I get COVID and die? There are a lot of other considerations on the line.
Will a mask protect you as well as protecting others? Does it work both ways?
Yes, and originally you might remember that, there was a campaign about my mask is to protect you, your mask is to protect me.
Right.
That still holds true, but more data has come out that shows that your mask protects you as well. Not as well as if both people are masked, but yes, there is a level of protection. And if you're wearing an N95 mask or a KN95 mask, that level of protection is even greater. Cloth masks, um, gaiters, gaiters definitely very ineffective. Cloth masks slightly more effective. Surgical masks slightly more effective, but N95 and KN95s give you the greatest deal of protection.
Yeah. Well, this mask ruling comes about a week after we learned how prominent Washington officials contracted COVID after attending a crowded party. Talk to me about how politics, science, and the law are clearly not in line. Uh, should they be in the first place, or is that even possible?
Well, I think it is definitely possible, but I think the fourth leg of that stool is economics.
Yeah.
And it's really what has been the struggle all along is balancing our economic well-being with our physical well-being, and decisions that are being made that seem to pit the two against each other. Um, I do believe, with sort of the COVID economic help coming from government officials going away, that it's put even more pressure on people to get back, into sort of the normal economic way of relating to each other. And so that is even putting more pressure. So, for example, the airlines feel that by removing the mask mandate, that's going to increase business travel, because personal travel hasn't suffered at all, right? The bookings are up right now, as a matter of fact, but they're really trying to lure that business traveler back. And so these considerations are actually weighing against the common sense public health of, if you take a mask off in a crowded area during a surge, more people are going to get COVID and that surge is going to be fueled.
Talk to me about this analogy that I'm going to share with you. Uh, you remember that, of course, there was a time when there were all of these smoking, guidelines. These smoking guidelines are in place. We know that smoking is bad for you. You can't smoke indoors in most places. And we have warnings on cigarette packages. Cigarettes are still made, they're still sold. People continue to smoke them. You have been a huge voice in the midst of the pandemic, especially, of course, sounding this alarm about the Black and brown community, and and people of color are still, big smokers. Is it the same? The risk of, say, secondhand smoke in the same light of secondhand COVID? If somebody has, COVID, masks, and you don't have it, but you're in the room with, with others, it seems to me to be pretty much the same thing.
I think that's a really good analogy. Um, I think that, the risks that you pose to somebody else by your personal decision to smoke affects your body, but it also affects the bodies of those around you. I think the difference, though, is that exposure to a small amount of secondhand smoke, say on a plane ride, is not going to give you the detrimental effects in the long run. It's really sustained exposure to secondhand smoke, as opposed to COVID. A one-time exposure to COVID could lead to many weeks or years of disability, as we've seen. Not to mention, of course, the terrible outcome of hospitalization and death. So I think, the analogy holds up in certain ways, but in other ways, it's that one-time exposure that's the difference.
Mhm. Uh, as I mentioned, smoking is still an issue for the Black and Brown community. COVID still an issue for the Black and Brown community. There are still issues with uh, vaccine resistance and the like. Your thoughts about that?
I feel very strongly about that. There was an article that came out recently that said that public sentiment, from our white brothers and sisters, um, when it was shown that COVID disproportionately affected people of color, that's when the calls for take off the mask, let us go back to work, allow us to be free and do what we want to do, increased exponentially. Um, and so I would warn people of color, look, these mandates, these mask mandates, these vaccine the availability, please take advantage of wearing your mask and getting vaccinated because we are being disproportionately affected and we cannot listen to the noise of the general population because they feel as if they're immune, right? A lot, I won't say white people in general, but a lot do feel like they're immune, especially the ones that are making the most noise about rescinding these policies. And so we have to look at what's happening to us. What's happening to us is a 2 to 3 times higher death rate. They're now saying that with long COVID, as I've mentioned before, that Black people and people of color are going to be disproportionately affected and are disproportionately affected. And when they go to seek care, because it's so difficult to diagnose, we already know that people of color interacting with the healthcare system sometimes is fraught with communication difficulties, bias, etc. So getting true treatment for long COVID is going to be more challenging for people of color. So keep all those things in mind. Don't be influenced by the noise. Don't be influenced by the disinformation because it's not for you. It is not meant to help you. What's meant to help you is getting vaccinated, getting boosted. If you're over 50, you're eligible for your second booster shot. And please continue to wear your masks because we are in the middle of a growing surge.
Recently, I was watching a news report about the ramping up, back to the planes again, the ramping up of travel. Some 2 million people a day are now flying. When it comes to a sense of normalcy, how would you characterize that while still understanding that there are risks for not just travel, but just returning to that sense of normalcy?
Right. I believe that we have to look at a new normal. That new normal means being aware that COVID is still out there, even though these mask mandates are going away, even though vaccination might not be as highlighted as it's been, right? We have to, as I mentioned, still put that into our equation as we go about our normal lives. Testing, also a huge component, because if you catch COVID early, you can get treatment for it. There's very effective oral treatment available, especially, like I said, if you catch your diagnosis within the first few days. So we're not going to return to life as before, at least not right now. Um, and travel, you have to weigh the risks and benefits, especially if you're under vaccinated. By that, I mean not boosted or not having had your second booster if you're over 50.
I want to go back to something that we saw in the beginning of the pandemic that seems to have quieted some, or at least there's not as much reporting on it, but it very well may still be out there, and that is the runaway COVID misinformation that continues. I'll give you one of the examples that I've always found to be most disturbing and silly is that, and I'm sure you remember this, that COVID was a product of 5G cellular towers,
Hmm.
and that had to be one of the most ridiculous, uh, controversial pieces of misinformation. So, how do you feel about misinformation? Is it still out there? And how do you try to address it when having these conversations with your patients?
So, Harold, it's still very much out there. And many of the people who remain unvaccinated go to these various, they're existing in a bubble of misinformation. And it's important to realize that early on, this misinformation, this was a study done out of University of Maryland, Center for Health Equity. Misinformation about vaccination, not just COVID vaccination, but all vaccinations, actually was generated by the same Russian bots and trolls that influenced the 2016 election. Disinformation is a method of weakening a society, a community, and it's truly divided us, right? And because of social media algorithms, those people that click on that only receive more information like that. So it creates a disinformation bubble, and it still exists. People are still predicating their decisions based on it. I have been, ever since April of 2020, I have a streaming show called Excuse Me Doctor, and it's really an opportunity for people to engage with me and my co-host to get their questions. We deal with all health questions, but we have talked a lot about COVID, among others. I actually have a 2 to 3 minute segment of the show where I take a piece of disinformation and I debunk it. I explain what it is. I explain what the correct information is that you should be basing your facts on, so that everyone can understand. And I've talked about the 5G, I've talked about the microchips, I talked about the alleged decreased fertility. We've covered it all, right? Um, and we actually get a lot of people coming online when we do that, thanking us, but we also get a lot of people, calling us agents of Bill Gates, right? So, it's definitely still out there. And it's sad, as I mentioned before, that we are not having the insight to understand the death and destruction that's happened as a result of COVID, and the fact that vaccination is one way is one of the ways, actually the most effective way to diminish that.
Mhm. And maybe the editorial at the end of "Excuse Me, Doctor" should be, "Say what, doc?" You know? For
Right.
for the other members of our family.
Right. Well, right, exactly. Well, it's actually, the title is taken from my book, the title of my book, which is "Excuse Me, Doctor, I've Got What? Taking ownership of your health, taking ownership of your health and making healthcare work for you." And it's all about being your own best advocate and how to navigate the healthcare system.
Let's quickly go through some of the latest COVID numbers. We do know the cases are up nearly 20% just over the past week. Deaths are down 12%. We're averaging about 476 COVID deaths daily. Hospitalizations are down 4%. The numbers are encouraging compared to a year ago. Your thoughts about the way the numbers are declining?
I think it's fantastic. I think it's partly a testament to the number of people who are vaccinated and boosted, plus the number of people who had Omicron over the last surge that we had, and still have some immunity left over because of that. So there are only two ways to get antibodies, right? Get COVID or get vaccinated. Um, you can also get an infusion of antibodies as well as a third way, but that's much more rare. So it's important, though, to keep in mind that hospitalizations lag behind cases by 2 to 3 weeks. So even though we are decreasing in the deaths and hospitalizations, thank God, the fact that cases are going up, and it's actually on 20% overall nationwide, but in many places that I outlined before, the South, the Midwest, the Mid-Atlantic, the Northeast, it's 25 to 40% jump from last week. So what we really need to do is, if we had a crystal ball where we could look into the future 2 to 3 weeks from now to see what's happening, that's really what is going to tell us, you know, is everything that we have in place enough to keep hospitalizations and deaths down? We don't know that. We're keeping our fingers crossed. But the more we wear our masks, the more we get vaccinated and boosted, the more we keep our activities outdoors instead of indoors, the more we wash our hands, the better the chance we'll have to squash the number of cases that might ultimately lead to hospitalization and death.
Dr. Melissa Clarke, co-founder of the Black Coalition Against COVID-19. Thank you so much for sharing with us. I really appreciate your time and your expertise.
You're welcome, Howard. Harold, sorry. Thank you so much for having me.
Sure. And thank you for joining us for another week of COVID Conversations. As always, we promise to continue to bring you the experts to help you go beyond the fear to the facts about COVID. We want to make the best decisions to help you and your family be safe. We wish you good health. Have a good day.